Most people assume heart problems always arrive dramatically. Severe chest pain, a medical emergency, a moment impossible to ignore. But in reality, the body often sends quiet signals first. A strange feeling in the jaw, unusual exhaustion, swelling around the ankles, or getting out of breath during simple activities that never used to feel difficult. The problem is, many people explain these signs away. Stress, poor sleep, aging, I'm probably just tired. Meanwhile, the heart may already be under strain quietly in the background. In this video, we are going through 10 silent signs your heart may be struggling, including one warning sign many people completely overlook until much better. And if you've been feeling a little different recently, this video may help you notice something important earlier than most people do. Sign number 1. Sweating without a clear reason. Let's start with something many people brush off completely. We all sweat during exercise or in hot weather. That's normal. But unusual sweating while resting quietly, especially cold or clammy sweating, can sometimes be the reason the body is responding to physical strain. Some people notice it while sitting still. Others notice they suddenly feel sweaty during simple activities that never used to affect them before. What makes this sign important is that many people never connect it to heart health. They assume it's stress, heat, anxiety, or simply a random moment. Now, sweating alone doesn't automatically mean something serious is happening. But unusual sweating that appears together with chest discomfort, dizziness, weakness, or shortness of breath deserves attention. Sign number 2. Pain in the jaw, neck, or upper back. This is one of the reasons heart problems are sometimes missed early. The discomfort doesn't always stay in the chest. Sometimes it spreads quietly into the jaw, the neck, the shoulder, or the upper back. And because the discomfort appears in unexpected places, many people assume it's something else entirely. Maybe stress, maybe poor posture, maybe a dental problem. Some people even visit the dentist first because the discomfort feels like pressure around the jaw. What surprises many people is that heart-related discomfort can travel through shared nerve pathways, causing pain to appear far away from the heart itself, especially when this discomfort keeps returning during physical activity or improves with rest. It's not something people should ignore. Sign number 3. Constant tiredness that feels different. We all feel tired sometimes, but this is different. This is the kind of exhaustion that slowly changes daily life. Some people wake up feeling drained even after sleeping. Others notice simple tasks suddenly feel heavier than before. Carrying groceries, walking upstairs, even short walks begin feeling unusually tiring. And because the change often happens gradually, many people adjust to it without realizing how much the energy has changed over time. In some cases, when the heart isn't pumping efficiently, the body may struggle to deliver enough oxygen-rich blood where it's needed most. And over time, that can leave a person feeling constantly low on energy. This is one of the most ignored warning signs because people simply blame age or a busy lifestyle. Sign number 4. Swollen feet, ankles, or sock marks. A human named Mary started noticing something strange every evening. Her shoes suddenly feel tighter than usual. And when she removed her socks at night, deep marks stayed around her ankles longer than before. At first, she blamed salt, then long work days, then aging. But over time, the swelling became harder to ignore. In some cases, this happens because the heart is no longer moving blood efficiently through the body. When circulation slows down, fluid can gradually collect in the legs, feet, and ankles. And because this change can often happen slowly, many people adapt to it without realizing the body may be signaling something deeper. One thing many people overlook is how gradually this develops. The body often changes little by little before people consciously notice something is different. Sign number 5. Pressure, burning, or indigestion-like discomfort. Heart-related discomfort doesn't always feel like dramatic chest pain. Sometimes it can feel surprisingly similar to indigestion, pressure, burning, fullness, or discomfort in the upper stomach area. And because these sensations can resemble common digestive issues, many people dismiss them completely. Some people repeatedly treat the discomfort with antacids without realizing the body may be signaling something else. Now, this doesn't mean every case of heartburn is heart-related, but unusual discomfort that keeps returning, especially alongside fatigue, sweating, dizziness, or shortness of breath, deserves attention, especially when the sensation appears during movement, stress, or physical activity. Some of these signs are even easier to ignore because many people assume they are caused by stress, poor sleep, or normal aging. But the body often sends subtle signals long before people expect something serious. Sign number 6. Waking up tired or short of breath at night. Have you noticed you've started sleeping differently lately? Maybe you woke up suddenly during the night, feeling uncomfortable, restless, short of breath, or needing to sit up to breathe more comfortably. Others sleep through the night but still wake up feeling exhausted every morning. And because modern life is stressful, many people blame anxiety, aging, or poor sleep habits. But sometimes, the heart and lungs may be under strain during sleep without a person realizing it. In some cases, fluid can build up in the lungs more noticeably while lying flat, making breathing feel more difficult during the night. This is actually something I talked about more deeply in another video about nighttime warning signs many people overlook, because the body often reveals problems more clearly during rest. Sign number 7. Bleeding gums and the mouth-heart connection. This is one many people never expect. Bleeding gums may not seem connected to the heart at all, but researchers have spent years studying the relationship between gum disease, inflammation, and cardiovascular health. A man named David noticed something small every morning. Whenever he brushed his teeth, he kept seeing traces of blood in the sink. He assumed his gums were just sensitive, so he ignored it. What many people don't realize is that long-term gum inflammation may affect blood vessels elsewhere in the body. That is one reason dentists sometimes notice health problems before patients do. Now, bleeding gums don't automatically mean someone has heart disease, but persistent gum inflammation is definitely not something people should ignore, especially when it appears alongside other warning signs before happening throughout the body. Sign number 8. Frequent dizziness or lightheadedness. Have you ever stood up and suddenly felt unsteady, or felt slightly dizzy while walking for no clear reason? Occasional dizziness can happen for many harmless reasons, but repeated episodes shouldn't always be brushed aside. Sometimes the brain may not be getting enough blood flow briefly, and in some cases, the heart may be part of the reason. This is where many people get confused because the dizziness usually lasts only a few seconds, so they ignore it. But recurring lightheadedness, especially when combined with weakness, fatigue, chest discomfort, or regular heartbeats, deserves medical attention. Sign number 9. A persistent dry cough. Most people would never connect a cough to the heart, especially when there is no fever or cold. But sometimes, a dry cough that lingers for weeks without improving may be connected to fluid buildup inside the lungs. When the heart struggles to move blood efficiently, pressure can slowly build inside the blood vessels around the lungs, and over time, that may trigger coughing, especially while lying down. Now again, many conditions can cause coughing. This doesn't automatically mean someone has a heart problem, but a cough that keeps returning alongside fatigue, swelling, or breathing difficulties shouldn't simply be ignored forever. Sign number 10. Reduce walking endurance. This may be one of the overlooked warning signs of all, because it usually happens slowly. A person who once walked comfortably may suddenly begin slowing down more often. Frequent breaks become normal. Short walks feel longer. Simple movement feels more tiring than it used to. And because the decline happens gradually, many people adapt to it without questioning why. But the body often notices reduced endurance long before people consciously recognize the change. That is why paying attention to subtle physical changes matters so much. Sometimes the body whispers before it screams. The good news is, the body often gives warning signs early, And recognizing these changes earlier gives people more time to make healthy adjustments, ask questions, and take their heart health more seriously. Having one of these signs doesn't automatically mean something is seriously wrong, but repeatedly ignoring changes in the body is never a good idea either. If you notice that several of these signs happen more often at night, you should definitely watch my video on nighttime heart warning signs many people ignore. And if you enjoy calm, simple health videos that break complicated topics down in a practical way, then this channel was made for you. Because one of the biggest mistakes people make is waiting until health problems become loud before paying attention. But interestingly, many health problems become worse because small daily habits repeated over time without people realizing the damage. And in the next video, we are going to talk about some everyday habits that may quietly hurt your heart more than you think. I'll see you there.